Some shocking statistics about kids and suicide to report tonight. A Vanderbilt study shows the number of hospitalized kids who had attempted suicide or had suicidal thoughts more than doubled since 2008. As News Channel 5's Kyle Horan explains, it's having a larger impact on teenagers than young children.
And the author of this study says he believes there could be a number of reasons why this is happening. An increase in depression, could be family issues, or even social media.
We really want to be able to prevent this.
In his work with children, Dr. Greg Plemons said this is particularly unsettling.
One of the things we wanted specifically to look at was the number of patients that present to the emergency room or admitted to a hospital following a suicide attempt or having suicidal thoughts.
Data was collected over 31 hospitals, representing every geographic region in the country. This trend is nationwide. In 2008, of all the kids admitted to these hospitals, 0.6% had either attempted suicide or had suicidal thoughts. That number grew through the years to the point where in 2015, the number was nearly 1.8%. It increased just about 3 times. That may seem like a small number, but in just 7 years, just the hospitals studied had nearly 116,000 encounters with suicidal kids.
We know that anxiety and depression are on the rise among kids and teenagers. We know that colleges, for instance, have reported a huge uptick in mental health services. So we know that this is a problem that's been going on for a while.
But what's causing it?
Perhaps there's influence of social media and cyberbullying. Perhaps there's more increasingly driven anxiety about school performance and performing well. I think there's still a lot of area of research that needs to be done.
A history of depression in the family could also be the cause, but Dr. Plemons says there might be a way to head it off.
Part of it is destigmatizing mental illness. I think that's a huge part. I think there's still a huge stigma around mental illness, and so having that conversation, not being afraid to ask kids about these kinds of things is really crucial and important.
Kyle Horan, News Channel 5.
Dr. Plemons says identifying suicidal kids can be difficult. It's not always obvious when there's a problem.